Hi, this is Wei-Shin again, and I'm here at Audiology with Dr. Workman, and we're going to find out a little bit more about how sleep phones are being used in an audiology environment. So my first question for you is, can you tell us a little bit about what Audiology does and the types of patients that you see?
So at Audiology, we are audiologists. So we diagnose, treat, and manage problems related to hearing, balance, and tinnitus. So at Audiology, we primarily focus on the hearing aspect of things as well as tinnitus. So where SleepPhones has really come into play is how we work with tinnitus. During the day, patients, if they have hearing loss with their tinnitus, we're able to give them hearing aids to use.
And tinnitus is kind of a ringing in the ears or a pulsing in the ears?
Yeah, it can be perceived really in any number of ways. It's been described as a ringing, a pulsing, a buzzing, a whistling. Really the sky's the limit into what these individuals are perceiving on a daily basis.
I heard a lot of people have this.
A lot of people
like
do
30%
have it.
or something?
It's certainly
like
a large
by the time
number.
You get
It's
being older.
It's a lot, and certainly not a lot of people are, seeking or receiving the help that they need for it. So that's what, we've really been able to do is, provide that one-on-one attention that some of these patients really need. Certainly if they have hearing loss in addition to their tinnitus, typically hearing aid solves kind of both problems and is able to manage both problems. But when, the hearing aids come out at night and they're trying to sleep, they hear their tinnitus, and that can cause anxiety. It can, prevent them from relaxing, prevent them from falling asleep. Which can kind of perpetuate this cycle of discomfort. And in the past, before I heard about sleep phones, I would generally, recommend trying to keep a tabletop sound generator, playing some kind of nature sounds, like a white noise, nature, really anything that is particularly soothing, just to keep the environment sound enriched.
So that the tinnitus doesn't bother them
Exactly.
as much.
So if they wake up in the middle of the night, it's not stark silence and, blazing tinnitus. So that way we're able to provide, less of a contrast between the tinnitus and something else that's soothing. Which is great in theory, but if there's anyone else that's in the room with them at night trying to sleep and they don't like to listen to that sound, now the other person's not too happy. So what the SleepPhones has really, opened up a door to do is allow people to listen to these soothing sounds at, like I mentioned before, safe levels, and really just, listen to by themselves. They're not disturbing anyone else, and they're at the same time, able to put themselves hopefully into a more relaxing state of mind, to distract themselves and manage the tinnitus in that moment.
Okay.
Yes.
Yeah. So I guess you also see some musicians sometimes, right?
We do also see some musicians, and certainly that's something we will offer, custom hearing protection, filtered plugs so that they can preserve the frequency response of their music. Also as a musician, that's something that's really important to me. You definitely want the right kind of product. So certainly...
What do you play?
I play the flute and the piccolo and the piano.
Wow,
so
multi-talented.
Not really. But certainly hearing protection is a big thing there because you need to preserve what you have. And oftentimes, if you're in a marching band, if you're in a band in the garage, if you're even in an orchestra, you're surrounded by 70 other instruments, and that's a really noisy situation. So you need something that's going to protect your hearing, but allow you, to maintain that frequency response so you can hear what you're playing. And so certainly with musicians, something that's appropriately fit is going to be the best option there.
Yeah.
Yes.
Okay.
Yeah.
And I guess my other question is, like aside from tinnitus, are there other situations, like maybe, I guess you're traveling soon too, right? And so you're going to be using sleep phones?
Yes, I will. As I mentioned before, I don't like the feeling of headphones that sit in my ear or sit on top of, because I just find them very uncomfortable. So, sleep phones has really been kind of a nice open door there too. So now, if I'm on a long distance road trip or something, and if I just want to listen to my music, it's a nice comfortable option. So I've been really happy to use the product and learn from it.
Okay,
So,
great. So another question that we got from the audience was the types of music that you can listen to. So some people might like piano or rock or white noise. Like, are there specific suggestions you have for
I would
tinnitus?
say, for tinnitus, it's kind of specific. You typically don't want to listen necessarily to music because, we want to keep our emotions pretty neutral at that time. And music is one of those things that can really elicit, a lot of emotion. So it's really best to, I typically recommend a neutral sound. So something like white noise, or if you can listen to like wind chimes, something where like you can't really predict what's coming next. Or nature sound if there's like a babbling brook or a thunderstorm, something like that where it's just a neutral backdrop of sound that can provide that distraction but also provide that relaxation.
Okay. So with earbuds and hearing aids and just stuff like being in the ear for most of the day, that can sometimes compact the room in earwax and sometimes even like if it doesn't fit very well, it can cause pain. So like have you seen problems related to stuff in the ears?
I certainly have.
Okay.
That's generally why at the end of the day we say, take the hearing aids out. It can be good to give your brain a break, from so much stimulation. Tinnitus aside, but it can also cause discomfort. So, if you're sleeping with, headphones in the ear, or if you're sleeping, with the hearing aid in the ear, it can cause pressure points in the canal, which then could possibly turn into sores or, other uncomfortable situations. Certainly, impacted cerumen because you haven't given your ear a chance to do its natural process of letting the wax back itself out of the ear. So definitely good to, if you've been wearing something, all day, good to give it a break at night.
Okay.
Yes.
Over the years, have you seen more and more young people in your practice because more and more people are listening to, stuff in their...
Yes. And that's certainly a cause for concern because these young people are brought up, headphones are normal. Everyone walks around the street with their headphones in. They sit in study hall with their headphones in. And, certainly there's not necessarily any control over how much volume they're putting into their ears. And that's, very alarming to me just because I see, noise-induced hearing loss on a regular basis, and I want to prevent that from happening because, once your hearing is gone, nothing can completely restore it. Sure, hearing aids are available, and sure, they're, awesome and very helpful, but nothing can restore that hearing, that you had. And noise-induced hearing loss is the only kind of preventable hearing loss out there. So, if it's ever in your power, don't listen to the headphones all day long. Listen at those, safe and comfortable levels, just so that you don't, cause that noise-induced hearing loss in the future.
Yeah. So another question that came in was, how people will go to the dentist for checkups and then, to the eye doctor to check their eyes. So going to an audiologist, do you have specific tips for people to help prevent hearing loss over time and to preserve their hearing?
So typically I'll say, if noise is of concern, if you're in a situation, there's a lawnmower going on and you're not the one doing the lawn mowing, walk away. Put yourself, a good distance between, the noisy cause and yourself, because distance can protect hearing. If you're listening to a personal music device, it's always turn it to the left, turn it down, keep it at safe levels. One of the other important things is, if you're going to a concert, if you are mowing the lawn, if you're going to fireworks, anything that is very, very loud, always use hearing protection, because that is, like I said, 100% preventable.
Yeah.
We live in a noisy world and none of us is completely immune to it, but if you're putting yourself in those situations, you certainly have to take precautions. And start your annual hearing test. You have your annual eye exam, your 6-month cleaning at the dentist. You should really add your annual hearing test onto that battery of exams. But the sooner we're able to detect a hearing loss, or at the very least, or at the very least, obtain a good baseline, we can track those changes over the time. And certainly the sooner that we start to see hearing loss, the earlier we're able to treat and manage. So.
Cool. Yes. Yeah. I know for us, I actually always carry earplugs in my purse because I'm concerned about my 6-year-old, and I don't want you get into a situation you're like, well, I wasn't expecting this, and then but they're so small, so I just carry them, and so my purse full of junk, I just pull that out and stick them in. And
they're in my purse too.
I at least protect him. Yeah.
That's right. Now you've got to carry some to protect yourself too.
Yeah. Are there certain professions where you see a lot of patients from, they're in a loud environment?
I would say, definitely individuals working in like manufacturing plants or in industry where there's a lot of different machinery and it's very loud. Certainly individuals in the military who are exposed to firearms on a regular basis. These are very high noise level professions, and certainly I would recommend, using hearing protection, when you're around that noise.
Is there a particular type of hearing protection? Because there are the foam ones that stick in, and then there's the like silicone waxy kind of stuff, and then there's the big canned ones like you see at airports.
Yeah. So certainly there are the over the ear ones. You can certainly use the foam insert ones. The thing with that is you want to make sure that it's inserted completely, because if it's sticking out, then you're not getting that full noise reduction that you're supposed to have. And then certainly I would say one of the best options is the custom made just plugs. It's a silicone material, and it just completely blocks out your ear. It's going in your ear properly because it's made only for you, so you're really getting that maximum level of reduction. And it's never a bad idea to double up on that either. I'm a past trap shooter, and I used to use, the foam plugs in the ear with the over-the-ear buds. That was when I was 13, so I must have known I was going to be an audiologist.
Yeah,
then.
for sure.
But never a bad idea to use two different kinds either.
What are the main causes of tinnitus?
Certainly hearing loss is a big, function of that.
Okay.
But tinnitus is very much a multifaceted phenomenon. Certainly certain medications can cause tinnitus, or reactions between different medications.
Like aspirin, like
way too much aspirin.
Yeah.
Other things could be, if you have problems with your temporomandibular joint. If you've ever had head or neck injury, that can also cause tinnitus. Noise exposure can cause tinnitus.
I know that, oftentimes the severity of it varies depending on how stressed you are, because a lot of it is how you react to the sound. Because it might be there at the same level, but your brain, because it's under stress, just kind of stops the filters and it registers so much louder.
And it just keeps perpetuating the cycle.
Yeah, and it just makes you more and more anxious and upset. Yeah.
Right.
Yeah. Can you explain a little bit about how an ear works?
Yes. So a lot of people say, what we hear with our ears, which is only partially true. Our ears are really just the doorway in. So, as we hear, sound is collected by our outer ear, and then it travels down our ear canal and hits our eardrum. The sound hitting the eardrum sets those three little bones in the middle ear into motion, which then the stirrup, if you will, kind of lets the organ of hearing know that sound is coming in. So then the organ of hearing takes all of this information and transmits it. Cochlea, yep.
Yeah, okay.
Transmits all that information up the auditory nerve to the brain where it's processed and understood. So certainly, our ears are precious. They're fragile, sturdy, but we want to take care of them to the best of our abilities.
Yeah. And so that would be the sensory neural hearing, and then there's also conductive.
Yes, so conductive hearing loss is something that would be caused by like an ear infection or fluid in your middle ear space, where in itself, the cochlea and the nerve are both working functionally. So if we could theoretically bypass the problem going on, you would be able to hear just fine. Whereas the sensory neural hearing loss affects either the sensory cells on our organ of hearing or the nerve itself, and that's going to be more permanent in nature, and that's what's noise-induced hearing loss is a sensory neural hearing loss. So once it affects those structures, there's no reversing that.
So the noise-induced actually affects the cochlea itself.
Yes, it does.
And I've heard that there are these little hair cells in there with little otoliths, the little rock-like things. They're like probably sand size or even smaller, and so then it's and they get vibrated, and then so that's what sends the signal to.
So the little crystals are in our balance area, but on top of, if this is a hair cell, on top of the hair cell there's other tinier hairs. So when the stirrup sends that information, there's fluid in our cochlea, and that sends the information, and it kind of tickles those top hair cells, which then transmits that signal to the nerve. Those are little nerve endings.
And so if one of them breaks, or is that what causes the sensory neural? Like it just
yes, structural damage.
Structural damage to those actual little hairs, and so then like that can't repair that.
Right.
So what are some of the things that people do every day or frequently that may be a problem?
So if you're lawn mowing, This is something where, no, you don't want to put headphones in and crank the volume to overcome the lawnmower. You want to put the hearing protection in so that you don't hear the lawnmower. Another thing is if you're snow blowing. If we're in Erie, so naturally there's quite a bit of snow. If you're snow blowing, put the hearing protection in. Even if you're vacuuming, vacuums can really emit a ton of sound. So, if you're vacuuming your house, not a bad idea just to put some plugs on or in to protect yourself. A lot of concert goers, certainly, if you're going to a concert, I'm all for it, but you're going to want to listen at safe levels. And finally, there's, a lot of hunters and, people who shoot guns for sport, and that's definitely something. Those impulse noises are so hazardous to your ears, so you've got to do everything you can in that moment to protect yourself.
Okay, how high can that go up to?
I think it's like 140 decibels. So, one time can really wreak havoc on your auditory system.
Yeah, I had a patient once who, he was working in a garage, and they were fooling around because they're, college students, and one of the other guys blew an air gun in his ear, and he came in 2 weeks later. He's like, I still can't really hear out of it. I've got really bad tinnitus, it's ringing all the time, and so.
That's the kind of stuff that gives me chills. And certainly, you bring up a good point. Even a one-time exposure, people will say, well, it only happened one time. One-time exposures can leave a footprint, for the rest of your life. You think, say you go to that noisy concert and you leave, and sure, your ears are ringing, you feel like everything is muffled because you can't hear. You wake up in a couple mornings, it's gone. But, you feel fine, but that damage is still there. It has still left its footprint. So, when we see noise-induced hearing loss, it's this buildup, this accumulation over time of that damage that we incurred when we were young, going to concerts and doing what people do. Yeah.
Are there certain things that people are doing that you wish they would just stop doing?
Using Q-tips. It's
a pet peeve.
It's a pet peeve. Certainly there's science behind it that you think, you're putting it in, you're taking it out, but really you could be pushing more in than you're pulling out. So now you have a huge impaction in your ear, which could, make hearing difficult, not to mention painful, that really hurts. And something that, is of greater concern to me is, you don't necessarily know how deep you're going, and you could puncture your eardrum with the Q-tip, and there's, a branch of our facial nerve that sits right behind our eardrum, so heaven forbid you go right through the eardrum, you could also hit your facial nerve, which would obviously cause, a lot of damage.
Yeah, right, and that facial nerve, I know my 6-year-old has ear infections every now and then, and this one time he had a bad middle ear infection. He didn't complain about the ear, he never does. He complained about his jaw. Oh my goodness. And so then we were like, we're looking in his mouth and checking it and everything, and then that night his eardrum ruptured, and then it was like, all right, it was just the seventh nerve.
Goodness gracious. It just shows everything is so connected in here. It's all interrelated.
Thanks so much for
Thank
answering
you.
all these questions. It's
Pleasure.
very helpful. I think we all learned a lot today, and
I hope so.
And good luck with everything.
Thank you.
Yeah.
Thank you, Wei-Shin.
Take care.
Thanks.
Bye.